Assalamualaikum warahmatullahi wabarakatuh. Shalom salve, Om Swastiastu, Namo Buddhaya, dan salam kebajikan. Welcome to POD-Kes, our health law podcast. Today we're discussing something that sounds quite technical, but actually is in Indonesian reality every single day. That is the crisis of health infrastructure in Indonesia. Before we begin, I want to start with a real story. Earlier this year, a woman in Mamuju, West Sulawesi, had to be carried on a stretcher through severely unkept and foresty infrastructure. So to say, there is no infrastructure. And this has raised a very difficult question. What is the meaning of the constitutional rights to health if patients cannot physically come to the appropriate health institution? Today we'll discuss it amongst my friends, Arka, Fashan, Aurida, Adrian, and Daryl. Today we'll discuss it not only about hospitals and BPJS, which is normally discussed, but also roads, inequality, medical access, and whether Indonesia state is truly present in those people. So let's start from Arka.
Yeah.
From a constitutional perspective, where does Indonesia obligation to provide healthcare actually come from?
Well, the foundation is actually very clear in the Constitution, Article 28H, paragraph 1 of the 1945 Constitution, states that every person has the right to obtain healthcare services. And that follows along with Article 34, paragraph 3, which explicitly states that the state is responsible for providing proper healthcare facilities and public services. Now, that means that healthcare is not a charity, and it is also not merely a program by the government, but it is most importantly a constitutional right.
And legally, Indonesia has tried to build a massive framework around that right. Previously, healthcare regulation was very fragmented. There was law number 36 of 2009, law number 44 2009, and hospitals and so on. There's more. But fortunately, now there's law number 17 of 2023, which consolidates many of those laws into one omnibus framework.
So from a practitioner perspective, consolidation helps simplify regulation, but implementation remains a major problem. The law can promise healthcare access, but infrastructure determines whether that promise becomes a reality.
So when we talk about this, when we say infrastructure, it doesn't only necessarily mean only hospitals, right?
Exactly, right? Because legally speaking, roads, bridges, electricity, internet access, transportation systems, and even digital connectivity are part of a healthcare infrastructure. And that means, well, obviously a hospital would mean nothing if people don't have the roads, bridges, and or the means to get there in the first place.
Well, that's the key issue in Indonesia today. Like, we often celebrate healthcare provider and services such as BPJS coverage numbers, like around 97% of the population is registered under JKN. Internationally, Indonesia is praised for building one of the largest universal healthcare system in the world. But as we know, possessing a BPJS card doesn't mean that it is receiving healthcare. We know the reality of the infrastructure.
So that's a very good point, Arina. I want to ask Daryl. So Daryl, I see here you work directly or actually know the conditions of what is happening in Eastern Indonesia because you used to live there.
Yes.
What did you actually witness there?
Well, first of all, if I'm being honest here, the gap between how the legal promise and the reality itself is pretty big. In some areas in Maluku, some patients have to travel through a boat to get into any POD-Kes or any other health infrastructure. And during storms too, those things become impossible to take, right? And if like pregnant women, well, there are times when pregnant women themselves can't actually reach the emergency ER because of the sea access was cut off.
Well, this is not only Indonesia problem. According to World Bank data, hundreds of Indonesian sub-districts still lack adequate POD-Kes infrastructure, especially in Papua and West Papua. In some Papuan regions, communities still depend on missionary aircraft or air ambulances because roads simply does not exist.
Which in turn creates a very important constitutional issue in which rights become meaningless when the state lacks infrastructure necessary in order to deliver them in the first place.
Yeah, exactly. So sometimes in POD-Kes here, the buildings do exist, like administratively in the paper, but there's no doctor, there's no electricity sometimes, maybe even some limited medicine or even a lab. So technically the facility does exist, but meaningful healthcare just doesn't exist there.
And a healthcare worker in the country is actually still severe. If you've seen around many puskesmas around eastern Indonesia, Papua and whatnot, the puskesmas there is actually really understaffed. Right? Doctors and specialists, unfortunately, are more concentrated in Java and all the major cities.
Meanwhile, urban regions face a different types of infrastructure crisis. During the COVID-19 Delta wave in 2021, hospitals in Jakarta, Bekasi, and Surabaya reached its capacity. Patients search from hospital to hospital looking for ICU beds and oxygen supplies. So inequality exists not only between regions but also between healthcare demand and system capacity.
So Indonesia simultaneously have lack of access and also overcrowding in some places.
Pretty much.
Yes, exactly. And maternal healthcare reflects this clearly. In parts of like NTT or NTT and Papua, women still struggle to access obstetric case quickly enough, and transportation delays a major contributor to maternal mortality.
Oh, so this is quite. We move on to Law 17, 2023. As I read here, in that law, considering that we have a lack of access, it says that it promotes telemedicine, which, if the viewer doesn't know, is a digital way to talk about healthy life. So, is that realistic?
I would say the law is ambitious. Now, if you know, government regulation number 28 of 2024 formally recognizes telemedicine and digital health integration. However, implementation is still uneven.
Exactly, as we know, the telemedicine works relatively well in like big cities like Jakarta or Surabaya, but many remote areas still struggle with weak internet connectivity and unstable digital infrastructure. So a digital health system cannot function where internet signals barely exist.
Yeah. So in some places where I worked before, even basic communication networks were unstable and it can't even really be worked. So when policymakers try to discuss digital transformation, some healthcare or many healthcare workers in remote regions feel disconnected from that conversation as well.
So what's the use of a law if you can't even implement it in the first place?
Yeah, that's quite.
Yeah.
So, to wrap up, this is quite a very quick podcast. We're almost out of time. I like each of you to make a closing statement about this quite a puzzle of a situation that Indonesians are in. So, anybody wanna start?
I'd go
You
first.
back?
As I have stated, first of all, my name isn't back, my name is Marga. Now, second of all, I would first like to state that, as I've stated before already, what is the use of a law if in the end you can't even implement it in real life?
Yeah.
That is what it's simply what it is. You might create any programs that might help healthcare, but if the people can't even get there in the first place, what's the use of it? It's useless.
Yeah, what exactly is the use of the law? Well, if the implementation is fragmented and very jagged, I might say.
Well, for me, it's I think just genuine access to the healthcare infrastructure is should be prioritized first. Because of course, I did talk a lot about it before. It's really bad.
Yeah, as we mentioned before, health inequality in Indonesia is not only a medical issue, it's more of an infrastructure issue and a governance issue and ultimately a justice issue.
I also think that BPJS reform must go hand in hand with infrastructure reform. Financing alone cannot solve healthcare inequality.
Maybe that is the most important message today. Healthcare law is not only about regulations and legal documents. It's about whether the state, Indonesia at this point, is truly present when its citizens are most vulnerable. Thank you for watching today's podcast. Health Law Podcast. See you in the next episode. Wassalamualaikum warahmatullahi wabarakatuh. Bye.